So colleagues, let's move on to the next presentation, and that is on the global perspective on One Health. And the presenter is Professor Wanda Markotter. She is the director of the Center for Viral Zoonosis at the Faculty of Health Sciences at the University of Pretoria. She occupies the South African Research Chair in Infectious Diseases of Animal Health and Zoonosis, and a chair in People, Health and Places at the Future Africa Institute. Interdisciplinary research programs focusing on bat pathogenesis and the risk of spillover in Africa, a very important issue. In 2021, she was appointed as a co-chair of the One Health high-level expert panel. We often refer to it as OLEP. And this is involved in advising the WHO, the World Organization for Animal Health, the FAO, and United Nations Environment Program. And she's also a very active and important member of our One Health Forum and One Health Steering Committee as well. So welcome, Professor Markotter. The floor is yours.
Hey, thank you, Wayne, and welcome to all the participants. It's actually really exciting that we have this meeting and we're reviving some of our discussions around One Health in a broader stakeholder forum again. I hope everybody can clearly hear me. So I'm really gonna, this presentation is based on what's going on globally. So I'm gonna talk from my perspective as the co-chair of the One Health high-level expert panel and just share some important things that's been happening in this global environment, especially together with the quadripartite, the UN organizations. Let's see if this is going to move. So why are we talking about One Health again? I mean, it's not a new concept, but lately a lot of the conversations are going in that direction. And it is because of what happened with COVID and really thinking that we can't just continue doing things exactly the same way because it wasn't really working if we look back at the pandemic and if we also look at new pandemics and new epidemics that's arising every day. And I think one of the important things is this last sentence on the slide, that if we do look at where some of these pandemics and outbreaks are coming from, they're emerging from this microbial diversity that we find in nature. They mostly viral, but it's also the majority is zoonosis. And we also know that there's a lot of undiscovered pathogens that we also need to think about. But what's very important is this spillover interface. Pathogens are not just going to spill over from wildlife to livestock and to people if there's no interface. And this brings us really to what we're trying to say with the One Health concept. You know, we see diseases in animals, we see diseases in humans. Sometimes we have very siloed approaches to these. We just look at the animal side, we just look at the human side. But what's really important is that we really look at the interfaces between animal humans, and then really important and most of the time neglected is the environment and why we have these interfaces. And Zakani also mentioned that we really need to be prepared, and preparedness also goes a little bit back towards prevention, where we really want to also look at how we can prevent outbreaks going forward. So if we look at these interfaces, there's certain drivers, and this is just a few examples of things that we really need to consider if we want to look at implementing One Health approaches going forward. There's things like deforestation, intensive animal production, urbanization, pollution, and the list goes on that we really need to look at if we look at a One Health approach to be better prepared, prevent, and respond. So where does OLAP fit into all of this? So in 2021, more than 2 years ago, there was a call at the Paris Peace Forum from the French and the German government that we need to do things differently to, at that point, the tripartite, which was FAO, OIE, who is now WHO, and WHO. And although they were already working together in several intersectoral collaborations, there was a call that this needs to go further. And we also need to look at, like we've just explained, the environment. So UNEP was also part of this inception of a panel in 2021, where there was a call for experts. A panel was appointed of 26 members, and this panel started in May 2021. specifically to advise the quadripartite. It's a diverse group of members. I was appointed as co-chair together with Thomas Mettenleiter from Germany, and it's representatives of all over the world and really also a lot of different disciplines. It's not just a group of virologists, there's ecologists, there's social sciences, there's modelers, there's people working in the policy interface that's advising the quadripartite. And it's like I said, really about policy relevant scientific advice. So again, important. It's based on scientific advice. So there needs to be evidence-based advice in these environments. But then a lot of the things that I will share today and that we will talk about is that it's also providing guidance on a development of a long-term strategic approach on how we can, firstly, at that point, the focus was very much on zoonotic pandemics, but the focus has become broader than just looking at zoonotic diseases if we talk about One Health. There's also a very important role in the political environment that the panel is playing together with the quadripartite, where they have to provide high political visibility on the subject of One Health and strategic advice on how to implement it. So I think everybody has seen this slide now quite a few times, but one of the first things that ILAP did was developing a definition, and it wasn't something that we were planning to do, but when the panel started, we started debating between the 26 members what we mean with One Health. Takani was also saying that this morning, that we're not always clear what we mean. And we realized that there's a need to come up with a new definition. And this was published in a scientific journal, but also endorsed by the quadripartite and now in several policy and other documents accepted as a definition for One Health. I want to just highlight that it brings in human, domestic, wild animals, plants, and the wider environment. So it's really about everything. It mobilized multiple sectors, disciplines, and then I think the important thing, and we will also talk about this today, is that communities and society needs to be part of this. And while we're addressing health threats for human and animal health and ecosystems, we will also address the needs for clean water, energy, air, safe, nutritious food, climate change, and in the end, we need to look at sustainability. So it's really moving away from this anthropocentric approach where humans are the most important in this whole triangle, and the rest is just there, to a really cosmocentric approach. What is also important, I always want to show this slide because it was actually published with the definition, is that we put certain principles forward. And this is also part of the national discussion in South Africa around One Health, the global discussion within universities, within smaller projects, where we really need to look at equity between the sectors and disciplines, socio-political parity, where we need to include and engage with communities and marginalized voices. It's not just the scientific voices that should be heard or the governmental voices. It's really broader than that. There should be social ecological equilibrium. We need to take stewardship and responsibility to change things and actually leave a better world behind. And then transdisciplinary is embedded in the One Health concept. So this new definition really brings in all the previous definitions that developed through time: global health, One Health, eco health, planetary health is all embedded in this new definition that was put forward by ILAP and endorsed broader. What was actually a really, really big step forward is about 1 year after ILAP was started, we moved from tripartite to quadripartite, where UNEP was now part of the alliance, and this actually was really a big step forward, having that as an official communication that we're now dealing with a quadripartite, and the environment's part of that. So the quadripartite then, together with ILAP, develop a One Health joint plan of action that we will also talk more about today. And this really, if you look at the action tracks, it's not just about zoonosis, it's also about neglected zoonotic and vector-borne diseases. It brings in food safety risk, it brings in AMR, it brings in the environment, and a big action track on enhancing One Health capacities and One Health systems. So this is now really bringing all these different plans that we always see, bringing that together in one plan. It's not a new plan that we now have to throw all other plans out of the window. It's really bringing everything together and linking it in this plan of the quadripartite. They've also published the implementation plan that was now launched in early December. And all these things are available on the web for everybody to read on how we can actually do the implementation and some tools and structure to implementing things in countries. I will say a bit more about the steps when I talk about the National One Health Plan, but as Tsakani also mentioned, stakeholder analysis and situation analysis are key in the success of implementing these plans on country level. Quite a nice tool that we also released in December is the OHF inventory of One Health tools and resources that's available on the WHO website, where we've analyzed all the tools available and comments on what it can be used. Is it One Health? Is it not One Health? And we put this out for people to use as they want to go forward with One Health initiatives in country. We also started giving a bit of guidance around One Health aligned surveillance systems. You can call it collaborative surveillance, you can call it integrated surveillance, but it's really about looking broader than just testing animal and human samples. And I think the important thing is what's standing here in step 2, include driver-based surveillance. Look at climate change, look at weather, look at socio-economic factors. That needs to be part of what we bring into our surveillance and how we do risk management. So if we do talk about One Health in the context of spillover of zoonotic diseases, it is extremely important that we highlight prevention. And this was one of our recent publications that we published to provide direction of what we mean with prevention of zoonotic spillover. And it's really about that first case that we should prevent from spilling over from the environment or animals into the human population or into other animals. And if we look at prevention, One Health is key because it's about risk reduction activities. It's about looking and understanding infection dynamics in the natural host. You can call it the reservoir, also in the environment. And then addressing all the anthropogenic drivers of disease emergence is key. And bringing in what we just mentioned under integrated surveillance into this picture. So this is really key in preventing future pandemics and not just always respond and be really ready. There's definitely some economic benefit if we look at the costs of pandemic prevention. This is just some examples from the World Bank, just looking at if we invest in animal health systems, biosecurity on farms, reduced forestation, that there's really, that prevention is about a third of the cost of preparedness if we start making these calculations. So pandemic prevention and following a One Health approach is not just a cost, but it is an investment in the future that will actually reduce the cost of some of these other activities that we're currently focused on. There's really a big global commitment for One Health. This is just a few examples of where One Health is prominent in high-level political discussions, G7, G20, where ministers are really embracing these approaches and governments to look at how we can really do things better going forward in terms of a One Health approach. But I think in the end, I always like ending with this slide. It's a quote from my co-chair of OHF, Thomas, where he always say that One Health is not just a concept. It's really up to all of us. It's a way that we must think about everything that we do, a way that we live, the way that we approach research, the way that we approach national plans in government, and really thinking about a more holistic approach going forward. I think I'm going to stop there, Wayne. I hope I stayed within my time.